the time women deserve the same level of care and attention towards them. Women always uplift each other. The interplay of health between women and society is very, very important. So that is why we are studying about women's health. Healthy women is a healthy world. The awareness of and the advocacy of women's health is very vital for improving the quality of life and wellness of women. So that's why we are studying about women's health. So the initial part of my presentation was all about how this International Women's Day originated, and then even then it was about equality. Even today it is the same, and it's only because we don't have the awareness, or maybe we lack the knowledge of what is health, what are the constituents of health. And just I briefed about what are human rights and how health is an important aspect of human rights, and why women's health is important. So now I will go into some of the common conditions which we need to be addressed as women, and we are not supposed to suffer in silence, because the society, the communities impose it on the women, saying that this is normal for a woman. What's new in this? This has been happening throughout the ages. So this is all normal. So just bear it. So just bear with this. So this is what we have been always hearing, and we have suppressed our feelings, we have suppressed our discomfort, pain, and everything. And we are suffering. So now this is 21st century, and we don't want the same equality to go to the next century also. So here, this is the time where we have to be empowered, we have to be educated, and we have to stop suffering in silence. The first thing I want to talk about is the menstrual health. This is something, the first stage of a woman's life. All right, so she's reaching a menarche, she's reaching, age, puberty age, and this is a very, very important part of a woman's health, especially the reproductive, health. Actually, here I want to say that there are three things which are very, very unique to womanhood. The first is menstruation, the second is the pregnancy and breastfeeding, and third one is the menopause. Yes, indeed, there is a lot more than the reproductive, health, but most of the conditions revolve around these factors. So, menstrual health is an important part of every woman's life, and it is directly linked with the fertility of a woman. So, any irregularity in menstruation has many serious repercussions in later life. Okay, therefore, menstrual hygiene is a very, very vast topic, and it has been, it should be discussed with young women. It should not be a stigma. It should not be a taboo. People should discuss about, what is menstrual hygiene and how to take care of, one's own body during this phase of life. I have always seen, in our families, in our students or something, even if they have a lot of pain, they still have to go to school, they have to carry out all the activities, and their pain is just suppressed. Yes, menstruation is normal, but the pain which is coming along with that menstruation is not normal. This is a disease which we call it as a dysmenorrhea. Now, this is a disease many women don't even know that exists, because the media and the advertisements, they tell you that your blood is your strength, your period is your superpower, and all these ads make us feel invincible. There are a lot of products to keep the blood invisible, and what is invisible is like not there. So this is what we have been carrying. We feel that yes, periods are normal, the blood is normal, and the pain coming with that, the discomfort coming with that, the cramps coming with that, the mood swings coming with that is all normal. No, this is not. This is the first thing we have to change. Menstruation is normal, but menstrual pain is not normal. So we don't have to suffer with this. So this is the time where we have to go to a doctor. there are studies which says that the menstrual pain which has been ignored and neglected, and if this continues, throughout the age, this can end in some condition like endometrial cancers and endometriosis. There's so many conditions which can have a serious implications in the later life, just because we ignored the signs in the initial days. All right, so this is something which I want all the girls to take it seriously, all the moms there, all the ladies there. We don't want our children to suffer. We have suffered. This was told to us. We grew up with this notion that menstrual pain or period pain is normal, but period pain is not normal. This is a disease. This is called as dysmenorrhea, and this has to be addressed. All men in our family should understand this, that the woman will be bleeding, and she's having discomfort. So they have to be a support to her. They have to take care. It's not that she's just left because this is normal. This just happens. And this is, because it happens over and over doesn't mean that this is normal. So we have to stop this. We as women have to take a stand on this. Men will not do it unless women show this. So I say here, don't suffer in silence. All right. So maybe you have to take some pain relievers. Yes, it's okay to take some pain relievers. If the menstruation pain is there for 1 or 2 days, you can take some pain relievers and take rest. If it goes beyond, then maybe you have to visit a doctor. Then you can have some, hot beverages and hot warm bath or heating pad. You can have some good food. You can have adequate sleep and a lot of, rest and some kind of, massage or taking care. All the comfort given by the family members is enough, to take care of this kind of menstrual pain. I came across a study while I was doing a literature review on this, where they said that menstrual pain is almost equal to a pain of a heart attack nowadays. It is correlated. The pain or a man is getting during a heart attack is equal to the pain during the periods. It's so bad. It's so discomfort. And just imagine if a man had to go through this, for a week. Would the man be okay with it? Will the family members still would tell him, it's okay, go, don't let this pain stop you, and you can go and achieve your dreams and go out? No, nobody would say this. There was one more study, very fantastic study, which said that, when complaining about pain, men are more likely to be given painkillers or pain relievers, whereas women is just given some sympathy and some antidepressants. So her pain is just neglected or just ignored, and we are okay with this. We were okay with this all these years, but now we are not supposed to be okay with this. So we have to speak about this. Okay, just showing the advertisements that women are flying during their periods is not enough. You have to talk about your discomfort and take care of this condition. The next important condition, in women or girls is the polycystic ovarian syndrome, PCOS, which we oftenly call it as. So this PCOS is characterized again by irregular menstrual cycles and may lead to infertility in later stages. So if you see here in the picture, PCOS affects 1 in 10 women, and so it's very common, and 50% of women are going undiagnosed because they're not reporting about this, because it is related with menstruation, and anything with regarding the menstruation is considered normal. So these cases are just undiagnosed; they are going unnoticed. Okay, the exact cause of PCOS is still not known, but it is understood that there's a combination of some genetic factors and the life disorders. Okay, and we mostly see that the male hormones like the androgens and the testosterone are increased in PCOS, and on long term, maybe immediately the girl may not show much symptoms, but on long term, it can lead to insulin resistance, leading to type 2 diabetes mellitus, and the obesity what is coming along with PCOS can lead to increased cardiovascular diseases and endometrial cancers. Again, there is a lot of information and a lot of study research done on PCOS. So there is treatment available. Treatment is tailored according to women. So I request women who are having these symptoms of excessive hair on face, and they have severe pelvic pain, and they have suddenly increased in their weight, and they have abnormal growth of acne or pimples, and they are missing their periods. So these signs should not be just ignored. I request the mothers or the women who are having girls who sees this kind of symptoms in their life should report it to the doctors. And there is treatment, and every woman has to be treated separately, tailored made treatment or medicine or the therapies are available. Definitely some lifestyle modifications, healthy eating, regular exercises, and coping up with stress will manage the PCOS condition. So here again I want to emphasize, don't suffer in silence. You have to talk about this, open up about this condition. Next comes the breast cancer, the most common cancer in women, followed by the cervical cancer. Uh, the sad thing is every 4 minutes an Indian woman is diagnosed with breast cancer. And in every 13 minutes, one woman dies of breast cancer. So this definitely is an alarming statistics. And hence we are not supposed to ignore this condition. It's just because women have, breast doesn't mean that, we are okay with any kind of cancers here. So we are not supposed to, ignore this important body part, and we have to take care of, these conditions, these signs, which many women have, noticed, and they just ignore it because of shame, because of some kind of, taboo, or they don't want to report these things, and then eventually it leads to bad things, fatal things. So, well, what's good news in this is, yes, this is a disease which can be conquered. Yes, nowadays there are a lot of treatment, therapies, advanced medicine which take care of cancer. But the best thing is there are certain lifestyle changes to reduce the risk of breast cancer. So every woman has to go through this lifestyle modifications at certain from a certain age, so that she is never at a risk of having this deadly disease of breast cancer. So there are some modifiable and non-modifiable risk factors. If there is a family history of breast cancer or cervical cancer in a family member, now this information has to be brought to the oncologist and find out whether there's something which can be offered to them. So it's never too late. Remember that we can change this risk by changing our lifestyles. So by following healthy diet. By healthy diet, I mean to say a low calorie, low fat diet with lot of fresh fruits and vegetables and lot of dairy products we can consume. So, and following this healthy, yes, there are definitely the dietitian will help you. You have to seek the advice from a dietitian on regular basis to have a healthy diet. Then avoiding addictions like maybe smoking or alcohol, or even eating processed food. Lot of processed or packed foods have to be avoided. Junk food has to be avoided. The best thing is we have to eat local vegetables and fruits and the fresh ones. Also, we have to manage stress. Stress is something, again, it's a very, very vast topic, and every one of us suffer this condition, in day-to-day basis. It can be a family stress, emotional stress, financial stress, stress at the workplace. There can be a number of stress. But the only thing is, this has to be managed. I don't say, we can work without. There has to be some kind of stress so that we work efficiently. But then bad stress, like distress, are very bad. They can cause a lot of harmful effects on the body. So we should know how to manage stress. There are a lot of therapies for stress management. So which are available, and we should seek for this. We as women, we as educated women, we should seek for this kind of stress management programs. And also I feel that we have to maintain an ideal body weight, and this ideal body weight should start early in life, as a child and as a young adult, and then any time in life. It should not be like only when we have gained excess of weight, then we should run behind, losing weight and maintaining the diet and all that. So maintaining a healthy or ideal body weight has to be implemented in the very early stages. So we have to allow our girls to play a lot, to do a lot of exercises, running, jogging, skipping, cycling. All these things have to be inculcated into daily activities, and this has to be maintained. Why we need to be informed is when there is correctable factors, these can reduce the risk of breast cancer, and early detection of this disease can be done. Okay, and there's something called as breast self examination. So we have to, we as women, we have to examine our breast on day-to-day basis. So in front of the mirror, while sitting, while taking a shower, or while standing, lying down. So there are different stages and different positions to have a self examination, and it starts from as early as the age of 20. And if there is a first degree family members with the history of breast cancer, then yes, these people may have to visit an oncologist or the gynecologist to seek some preventive measures. So this was all about breast cancer. The next one is the high risk pregnancy. Now, pregnancy again is a very beautiful phase of any woman's life. But there are certain factors which can lead to high risk pregnancy. This involves increased risk of health risk of the pregnant person and the unborn baby, or maybe both. Now, this high risk pregnancy is being observed nowadays in lot of working women. Women who have a lot of pressure at their workplace as well as their home. They are not very much into taking care of their bodies. And by the time they become pregnant, because they are goal oriented, they are job oriented, they plan their pregnancy in the late ages, maybe somewhere around 30-35 years, or even beyond. That itself is a risk, or pregnancy that itself is a high risk. And along with the age, there come certain factors like there is anemia, there are habits like smoking or alcohol or excessive stress, and all these conditions can make a pregnancy at high risk. So these pregnancies require very close monitoring to reduce a chance of complications. However, having a pregnancy that is considered high risk doesn't mean that your unborn child or you may have problem or experience problem. There's nothing like that. Some women actually have very safe pregnancies and normal labor. But again, yes, these high risk pregnancies should not be ignored. Okay, so prevention again is important, like taking care of the habits, maintaining a healthy body weight. Planning the pregnancy between the age of 18 to 34 years is very important. When I have interviewed a lot of women with high risk pregnancy, they always say that we want to settle down in our life first to have a child. So they when I say what type of settling down, they talk merely in terms of financial securities, and other securities, like building a house, or having a permanent job. This is what they are talking about. Nobody talks about, developing their body or taking care of their body or preparing their body to, welcome a new member. So nobody talks about this preparation. They always, talk in preparation of their finance, their houses, and settling down and all that. So, in order to advance professionally, women sometimes have to prove their commitment at their work, regardless of being pregnant or having a family, and they suffer in silence. They don't talk about this condition. Maybe she is having discomfort, she is having problem, but just because she has some commitments, she doesn't talk and she suffers in silence. That's what I feel, that you don't have to be a superwoman. You are a human being just like any other person. If it was a male who would have come to the office with problems, they definitely talk about it and then gain that attention. And you being pregnant, you being you having so much of responsibilities, you're just okay with this. Just because you are okay with this, other people are okay with this. So you don't have to be a superwoman. You just need to find the right balance of working as well as taking care of your body. Many working women, come to office, then things will be fine. It is just that you have to talk about this to your gynecologist or a physiotherapist you're visiting, so that they can give you some comfort positions and some few exercises or some stress management habits or something like that, so you don't have to suffer in silence. One more devastating condition, a lot of women reporting to our, OPDs with urinary leak, or in medical term, what we call it as urinary incontinence. So, a lot of women who had difficult deliveries, prolonged labor, huge babies, use of instruments during delivery like forceps delivery or vacuum delivery. During delivery, there can be some insult or some damage to the pelvic floor muscles, and later in life, women present with this kind of condition where they have leaking of urine, and that is called as urinary incontinence. And 25 to 45% of women suffer from urinary incontinence each year, and this percentage tends to increase with age. Among these, percentage among people who have already had, leaking bladder, they say that 22% of them say that it has prevented them for participating in activities or their social life. Now, that's important. That's what if you remember, I spoke about, a social life, social health. When we are talking about health, social health, mental health, and physical health. So, here the woman is not having a physical health because, she has weak muscles, pelvic floor muscles, which are not able to uh, prevent the leakage. So that is a weak physical health. And then she leaks urine itself is a big mental stress on her. And because she is not able to participate in her social life is also affected. So to appear, maybe the woman looks healthy. She may look healthy. When you see her, nothing is visible, but then look at her suffering inside. All the three aspects she has been suffering. So you don't have to suffer in silence. This is a condition which has to be addressed, and unless you talk about it, nobody is going to understand. But the worst thing is, by the time the woman has already started leaking while she's coughing or squatting or sneezing or even talking loudly, it means that she has already neglected herself for so many years. And the best thing again here is, like, if you report, yes, there are therapies, there are a lot of treatments available which can treat the urinary incontinence. Yes, there are a lot of therapies, like from simple exercises till laser. There is a lot of advancement. Without surgeries also, the women can be taken care of this condition. And that's why I say, if any one of you or us are suffering with this kind of urinary leakage, it has to be reported as early as possible, and you don't have to suffer in silence. We came through the stages of women, like we spoke about menarche, menstruation, we spoke about the adolescent, we spoke about pregnancy, and now we are heading towards menopause. The menopause is one another part of women's life, which is called as puberty part 2. And menopause is nothing but a complete cessation of menstruation for a period of 1 year. And premenopause is a transition from a smooth transition which may last up to 10 years. During this time, of from your premenopausal state and till and you have reached the menopause, and you are when a woman is in a menopause stage, there are many conditions which can affect the woman. One of the common conditions is osteoporosis. Osteoporosis literally means porous bone. Okay, and according to studies conducted amongst Indian women, it is estimated that 230 million Indians expected to be over the age of 50. Okay, and in that, 46 million women are already suffering with osteoporosis. The lesser version of osteoporosis is osteopenia, which can be seen in many women after 45 years. So here the bones become thin and lose their strength, and they become less dense, and they are exposed to falls. Women are women can have falls, and they can break their bones, which can lead to a lot of disabilities, and it makes the activities of daily living extremely difficult. So 1 in 3 and 1 in 5 men suffer with this condition called as osteoporosis. Okay, again, yes, lifestyle disorder changes can definitely help. Vitamin D helps. Vitamin D and calcium supplements are the simple medications which is given when the woman is after 40, going to a doctor after the age of 45 years. Vitamin D helps to absorb the calcium which we are taking, and calcium stays in the bone. And in Indian population, I always say that the food we eat itself is enough for calcium. One glass of milk has somewhere around 300 milligrams of calcium. So twice a day, if she has that milk, so or milk products like curds or buttermilk, that's enough to take care of calcium supplements. But yes, indeed, many dietitians feel that the supplements are required after the age of 40, 45 years to support a woman's health. So definitely, we should not ignore this, and we should take care of our body, and we are not supposed to suffer in silence because of this condition. How to prevent it? Yes, you have to watch your diet. You have to regularly exercise. Exercises like weight-bearing exercise, we call it as like walking, jogging, lifting weight, and enough calcium and vitamin D. And yes, again, if there are habits like smoking, alcohol has to be totally cut down. One more common problem: sleep and wellness. 81% of women report having problems getting a good night's sleep daily. And then we don't, report this. We just are fooling ourselves, and we say that we are all healthy. So this is a very common problem. Not having a good sleep or not having an adequate sleep can increase the chances of being irritated, angry, and more stressful during the day, leading to many other complications in women. So we are not supposed to just ignore this. Just because we didn't sleep doesn't mean that the next day we are again superwoman. We have to take adequate rest in during our daytimes, and then complete the sleep pattern. So this is again something which most of the women, just ignore. So these were certain conditions. Some conditions. Again, I told you, there is lots. There is vast again to talk. but these were only few conditions which I just jotted down, because we commonly see this in our day-to-day OPDs. So I felt these things have to be addressed. And the best thing is treatment exists for everyone, and the best and the simple thing is lifestyle medicine. Nowadays, you don't have to talk about surgeries, you don't have to talk about pills and surgeries. The simple thing is lifestyle medicine. And what is lifestyle medicine? This is a medical approach. This is not just from Google or somebody's information. It is an actual medical approach which uses evidence-based behavioral interventions to prevent, treat, and manage various conditions. Okay, and this lifestyle medicine talks about what? Good health, diet, about exercising, about resting, about posturing, and getting connected to people, and talk about your problems, share your problems. Not just problems, even the good things, even the happy things, have to be shared, and then we connect with everyone, and then it's a beautiful medicine which has come up now, which is like superior to all your surgeries, all your pills, and all other therapies and treatments. So this is the best thing what we can do. Again, in a study, I found that most of our health conditions, just in that only 20% need some clinical care. Rest 80% can be managed with health behavior, socioeconomic factors, and physical environment. But look at the scenario here. The line is more towards pills and surgery because they're easy just to sculpt and solve all these things. And there's no one in the lifestyle changes. So this is the scenario here. So we have understood. So things are easy, but then we are making it complicated. Every we want to just take medicines, we want to increase the side effects, and then again for the side effects we take medicines, and then the cycle continues. And there are simple things like just the lifestyle changes, and nobody wants to do it because yes, it is a little lengthier procedure, because we have to do a lot of modifications on our diet or exercise and all these things. So people are less. There are no people in this queue. At the end, I just thought I'll put this picture. I have still not understood like is this fight for equality should be done. See, look at this path of women. It's of so much of obstacles, hurdles, barriers, and look at the men's path. There's nothing there, but still we are in the race. And look at the men. They are so much focused in spite of having a clear path. They're so much focused on, they're just bothered about their, competition. And look at the women. They're just looking at the men, asking for some consideration, and men are not bothered. But still, women are in the race. And I'm sure that women will overcome these hurdles and then wins the race also. So women are yes, we are totally different from the other gender. And I feel, we are not supposed to ignore our health. If we take care of our health, if we educate ourselves, if we, empower ourselves, things will be easier for us. Things will be better for us. Then we don't have to fight for equality even after centuries and centuries. So, this is what I wanted to convey on this International Women's Day today. I hope most of the things are clear. If there are any doubts or any comments or any suggestions, you're free to.
Oh, indeed, it was a wonderful session, ma'am.
Thank you so much.
Now it's open for discussion, and participants can ask your doubts if you have any. And you can type in chat box also. The doubts will be in the time. Now from participants, you can ask any doubt if you have. You can unmute yourself and you can ask your doubt. And you can ask your doubts in Kannada also. I hope the ma'am is comfortable with Kannada.
Yes.
If anyone from Karnataka, you can ask in Kannada. Kannada ಮಾತಾಡ್ರಿ ಏನ್ ಡೌಟ್ ಅಂದ್ರೆ ಕೇಳ್ಬೋದು ಮ್ಯಾಮ್ ಹತ್ರ. And you can ask him. Oh no. Yes.
Both useful season, sir.
Oh, thank you. Doubt ಕೇಳ್ರಿ. Doubt ಅಂದ್ರೆ ಕೇಳ್ರಿ.
Good evening, sir. Good evening, ma'am.
Yes, Angit. Yes.
My question is simple, sir. Like, ma'am has focused almost on working women and lifestyle changes. huh? So my question is that what about the people who are living in a community like village? They are not living in city. How they focus on their health and what can be done for the stigma management? They have fear to come out from the home only, and the concern area maybe we can do lots of things in the remote areas, and what can be the next CBR approach for them? Thank you.
Yes, sir. This is a very important thing. Empowering all the women. When I speak about women, it has to be all, inclusive of rural women, urban women, working women, women at home. And we as community, people, we are community physiotherapists or community-based other team members. We are supposed to empower our women in the community. So we have to create this awareness even there. Maybe this session we had here on this platform with a PowerPoint presentation and everything. But then yes, the women in the rural areas, remote areas are supposed to be aware of these conditions. We should go to their villages, we should go to their places, and then we have to talk, or we have to show them the pictures and educate them about simple conditions like breast cancer examination, menstrual pain, PCOD, and high risk pregnancy. All these things have to be told to them. Yes, this is the thing where we have to work a lot. That is why I feel we are still into that race of equality or something like that. So this is a collective thing, from the government, and we people are always ready, as from the private institutes and all that. We are ready to work in the community, and this awareness has to be created even to those people. I definitely support this.
Yes, ma'am. So why the private institute are not going and doing all these things?
No, it's not that.
Implementation is less, madam.
No,
That
it's
is my
not
question.
that institutes are not doing. See, whenever we talk about community rehabilitation, it's always the government who has to, take the charge. Just because I am in a private institute, I just cannot enter in the any talking about this. So there is a proper channel. I have to go through a proper, loop, proper channels, and then approach the people. So this has to be through the government, centers like the primary health centers or the local government bodies have to get involved into this. And then if they hire us like to create awareness, yes, we are always available. But without the government's approach, our entry is restricted there. That's the barrier.
For all
That's
the
the barrier.
information, madam. Yeah, thank you, ma'am. Thank for all the information from ma'am. Government, there is a lots of schemes are going on, and I think there is some DDW is there, District Disability Welfare Officers in Dharwar also. So they are maybe guide you for the better opportunity, madam. Thank you.
Yeah. See, one more barrier, what I always feel is, when I want to approach the government, there is a huge queue. There's a big line, and my appointment may not be there in the near, appointments. I have to wait a lot. I have gone through this. It's not, yes, government bodies are there on paper, but how much priority is given, it's still a question mark. So always entering into the community is a biggest barrier. We want to do, but yes, we have to go through again, as I told you, a lot of obstacles and a lot of barriers.
Okay, madam. Thank you. Thank you for all the information, ma'am. Wonderful session.
Thank you so much. Any other questions?
So anyone else? So thank you, ma'am. Indeed, it was a wonderful session, and thanks for sparing your valuable time with us. And I think the first person who comes to my mind is ma'am's name only when I thought about this program, as Women's Day. And because I met madam some years ago, I think some 5 years ago, we had a program, awareness program in SDM college. That time I met madam. Great, madam is very passionate about the community physiotherapy. That time itself, ma'am told. And it was a wonderful session, man. It was very informative, and it's more than a session. It was a sharing of your experience. That was I felt, and the same feeling maybe with the participants also. And
Yes, sir.
thanks,
Yes,
ma'am.
sir.
Thank you.
Yes, sir. Of course, sir. Like one feedback, sir. Like I feel like my like classroom only. Okay.
Yeah.
Yeah. Because like she was my like professor only. That.
Yeah. I know.
Yes.
I hope you did not sleep through the session anyway.
No, madam.
Thank you so much.
Wonderful session.
Okay, ma'am. So thanks, ma'am. Thanks once again. Then I request my fellow coordinator, Dr. Neeraj Mishra, sir. Sir is a lecturer of occupational therapy in CRC Davangere, to deliver the vote of thanks.
Thank you so much, sir. Happy Women's Day to all the ladies who are here, the unsung heroes of the society, I can say, who, as the last slide ma'am has shown us, how in spite of all the hurdles and obstacles, how you have been championing the cause of upliftment of the entire society itself, not only one or two individuals, but the entire society. Yes, it rests on the shoulder of women, and as is the saying also, behind every successful person there is a woman. So salute to all of you, and sincere thanks to our director in charge, officiating director, Shri B.V. Ram Kumar ji, director officiating NIPID. Also, I am thankful to Dr. Gyanvel Davangere for constantly motivating us to do these programs.
Thankful to the speaker for today, Dr. Salima. She has given a wonderful lecture, and madam, thank you so much for sparing out time from your busy schedule and sharing your experiences with us. And last but not the least, I am thankful to all the participants who have always made sure that any program from CRC Davangere gets the maximum number of participation from all across the country. So thanks to all of you again. And my dear colleague, Dr. Thamrai Silvan sir, for organizing such fantastic programs. So thanks one and all, and we hope to see you in our future programs. Thank you so much.
Thank you so much.
Thank you, Dr. Sir. Thank you, ma'am.
Thank you, sir.
Thanks for your time.
Thank you so much, sir.